Good morning. I'm Dr. Yoldas. I'd like to speak to you about rotator cuff injuries today. Rotator cuff sometimes is mispronounced by our patients, rotary cuff, etc. It's sort of funny. But basically it's the rotator cuff tendons, and shown here on this model, which is the right shoulder, underneath our deltoid muscle, we see the collarbone, the wing bone, or what we call the scapula. And shown here are the four rotator cuff muscles, the subscapularis, supraspinatus, infraspinatus, and teres. 90% of the time we're worried about this guy up here, the supraspinatus. This tissue connects the muscle to the bone and allows the bone to move and allows it to function. And over the course of a lifetime, like pulling a rope a million times, this tissue can get injured. So the majority of the times, about 2/3 of the time, people that injure the rotator cuff do not remember a specific event. But a third remember a specific motion. Hey, I was trying to catch the falling ladder, or I was moving the heavy suitcase, etc., and this tissue got injured. Like most injuries, there's a spectrum going from simple to complex where they can be just irritated. We use the word inflammation. Some old-fashioned terms of bursitis or impingement are indicated as well. That just means irritation around the tissue. 2, you can get a partial tear where this tendon is still attached. However, the attachment point is a little bit weakened or frayed. And then lastly, you can actually tear this all the way off the bone, where it is removed and the muscle works but is no longer hooked up here, and that can be quite painful. As you might imagine, the treatment options for all these are different. That if we have just irritation around the rotator cuff, an anti-inflammatory, a cortisone shot, or rest and physical therapy might be very effective to treat that, and it almost always is. However, if we do have some partial tearing to the rotator cuff, meaning it's still attached, the degree of the partial tear dictates what treatment options might be effective. If it's torn only 20% of the way through, simple things such as a biologic injection such as PRP or stem cells plus therapy might be effective. However, if it is torn more than 50% of the way through, some of those simple measures will not be effective and we have to repair it, which gets into this discussion of if it is torn off the bone. Once torn off the bone, or what we'll call a full tear to the rotator cuff, the body does not have the ability to stretch itself back and reattach itself, sort of like a spring let go from one end. We have to physically put it back there. If not, this tear will slowly get bigger and bigger and bigger and retract with time. And unfortunately, once it gets to that point, there are serious consequences. Fixing these type of tears have a couple different pathways. One, a partial tear that's been refractory to conservative treatment, arthroscopic surgery to clean it up, trim it, smoothing it out is very effective, takes about 30 minutes to do, sling for a week, therapy for about 6 weeks. In the case where we have a tear, full thickness tear that has to be repaired to the rotator cuff, that can be done arthroscopically, but takes about 30 to 45 minutes to do, go home the same day, sling for about 4 to 5 weeks, therapy about 3 to 4 months before resuming full activity such as a golf swing or swimming, etc. So it can return you back to full function. And lastly, something that's been new on the horizon for us for the past 2 to 3 years is that in the case we have a very large tear to the rotator cuff that is not flexible, not able to be stretched back where it belongs, we are able to put a graft material in there to take its place, different than what's been done before in years prior, something called a superior capsule reconstruction, or SCR. It's been very effective both nationally and internationally, and also helps prevent the role of need for further shoulder replacement. Its recovery is similar to a rotator cuff repair, but takes about an hour or so of surgical time to do. So you can see from the course of rotator cuff injuries, we have a whole spectrum of treatment from simple to complex, and we're able to provide all that here. So we'll be glad to talk to you about your injury and possible treatment options. Thank you.